Welcome to Talking Live. I'm Dr. Robi Ludwig, and Talking Live is collaborating this show with Preferred Health Magazine. We are so thrilled to have Dr. Habib Khan. Not only is he a veteran neurologist, but he's also an award-winning physician with Preferred Health Physicians and Magazine. And he's going to talk to us about sleep disorders. I am so thrilled to have Dr. Khan here because sleep disorders seem to be on the rise in the United States, and there's nothing more frustrating and in some cases dangerous really for our health than not being able to sleep. Dr. Khan, is it true that insomnia is on the rise?
That's very true, actually. Okay. Being a sleep physician, not only I come across patients with sleep apnea, but I think equal number of patients are suffering from insomnia, and they are the people who are actually misdiagnosed, and it takes them a long time to reach to a sleep specialist. So we are not identifying them, and they go through a lot of experimentation, starting from over-the-counter sleeping pills, and then the primary care physicians giving them different medications, and then they are sent for a sleep specialist to be evaluated for what's going on. So insomnia is again not something very simple, but it definitely affects your life.
Is there any modern research that indicates why we're having more sleep disorders right now, why this medical issue is on the rise?
Insomnia is basically you have a problem, either difficulty initiating the sleep or difficulty maintaining the sleep. And at a subconscious level, there is some sort of anxiety going on where you are unconsciously thinking about your sleep because you have failed to fall asleep or failed to have a good night's sleep for so many weeks. Sometimes it goes to months that you have not been able to fall asleep. And that starts a vicious cycle that throughout the day, not knowingly, you are so much focused on about your sleep that by the time you are ready to go to bed, that anxiety pops up, and it prevents you from falling asleep.
So it could be, do we think that screen time also is a contributing factor, and can hormones also play a role in insomnia? Because I speak to a lot of my friends and we talk about just how hard it is to either go to sleep or stay asleep, and it seems to increase with age. I remember there was a study that found that as people get older, the quality of their sleep seems to decrease.
That's very true. Plus, again, there are certain other things, as you rightly mentioned, the hormones. People don't realize that how much the hormones have an important role in putting us to good sleep. And not only the hormones, they can have other endocrine issues that can lead to, because everything is so tied together in the human body, and that one thing leads to other, and that's how we have problem. Not only the hormonal issue, but nutritional deficiencies. Okay, they are just something very important, and just like vitamin B12 deficiency, just like simple iron deficiency. So these things are very common in my patients who I see, and they have a presenting complaint of insomnia, but they also have underlying sleep disorders, like especially periodically movement disorder of sleep. So or they have restless legs, they are preventing them to fall asleep. So there are not many things in addition to just simple insomnia that we try to treat with a simple pill that does not exist. And majority of the time, there's some sort of a stressor this has happened in this person's life. So it's very important to listen to them, that what has happened. And sometimes the story goes years, that some stressor in their life that happened, and even the stressor has relieved, it has been resolved, but the insomnia persists. This is not uncommon to see in these people.
Mm. So it's so interesting because it's like what comes first when you don't get enough sleep. It can really create havoc both with the psyche and create problems physically. Can you tell us some of the emotional issues that can come up for us if we're not getting enough sleep, and some of the physical issues that can present themselves if someone is not getting the right amount of sleep?
Because not getting the right amount of sleep is like you are sleep deprived. So you are not getting enough sleep. And if you are sleep deprived for like days and months and everything, so things start happening. Like you, first of all, you are not able to focus. So you will have problem completing your job. Okay, so you are not focusing it well. And as you know yourself, you're intelligent enough to understand that you are not doing it right, and you are having difficulty. That creates anxiety at the back of your mind. And so what happens that in uh, uh, the whenever you try to do that job and you try to do it right, you have in back of your mind that you were not able to do so, that provoke more anxiety. So
Hmm.
that prevents you. So it is just like a cycle where you go into that. So whenever you think of that job, now it goes beyond that. Now you're not even starting the job. And same thing happens that it relates to your sleep, that you are thinking, will I be able to fall asleep tonight?
Yeah, yeah.
Then
So it's
if
like
I'm,
not only can you physically not
yeah,
fall
so
asleep, but
then if I'm not going to sleep tonight, then I will have a problem
mhm.
tomorrow in getting up, and then then I will have problem doing my job well. So that provokes anxiety, and if it's going on for quite a little bit more time, you start getting depressed.
So
So
I one of the things that I also read recently, because there's so many articles about sleep. There was this kind of oh, what was it called? It was called, there was a sleep resistance, like when people did not want to go to sleep and they would resist going to sleep, almost like babies, because it was the only time in their day or evening that they could have to themselves, and they didn't want to miss out on it. Even though they were tired, they would stop themselves from going to sleep because it felt so good to have this free time, if you will.
yeah, that's the true, and there could be a lot many reasons for those, because they want to have a time with the family. Let's say that toward the end of the day, that they don't want to fall asleep. They have some other assignment that they have been looking forward to, and that add on to that the that disturbs the regular sleep wake cycle as well, because normally that how we are designed, that if you are sleep deprived, it keeps accumulating, and the adenosine keep on accumulating, and then you just fall asleep, and that's how you start sleeping and falling asleep on inappropriate times and situations. But that thing can also disturb. And lately there is something that we have been seeing, that that people are so much engaged in their uh, job activities. Okay, that 24-hour doesn't seem to be enough to complete the job, and that is also contributing to the sleep disorder, especially the insomnia, and that is causing irregular sleep cycle. And even though they are getting the sleep in different time of the day, and the total amount, if you add those, maybe good 6, 7, 8 hours, but they are
Mm.
not taking at the right time and they are not getting a continuous good hours of sleep together.
I do have a question about sleep in terms of how do we know if we're getting enough sleep? There are people, it used to be, there used to be a lot of pride with people when they said, I only need 3 hours of sleep or 4 hours of sleep. It used to kind of be this macho kind of hardworking kind of statement people would make. But it really is a good question. There's a lot of variation in terms of how much sleep people need. So I'm wondering, how does a person know that they've gotten enough sleep? And is it possible that you need a certain amount of sleep at one point in your life and then it changes as you get older?
It's true and not true in a sense that when we are newborn, so the amount of sleep is way larger. That like it can go beyond 20 hours because the sleep is a tool to repair and grow.
Mhm.
So once we are in adult life, then average 6 to 8 hours sleep is still required. When I was doing my fellowship, it was thought that as you grow older, your need to sleep is also goes down. But that doesn't apply right now because even if you are older, you still need the same amount of sleep which an adult
Mm.
needs. Only difference is that when you get older, we get disturbance, a short amount of disturbance, the sleep fragmentation increases. And
And
so
why does that happen? Why does that happen?
because of the lack of the third stage of sleep. So most of the time, the third stage of sleep reduces as the age goes on. Okay, and
And what
that's
is that
how
called, the third stage of sleep?
the third stage of sleep is non-REM sleep where we dream. Okay,
Mm.
and then the fourth stage is the REM sleep where we have rapid eye movement sleep. That's again that stays there, and that is just like overall an average 90 minutes per sleep every night. So
Huh.
if a person is getting that 90 minutes of sleep, so that will make him refresh. And because of whatever reason, the sleep fragmentation or underlying sleep disorder, just like in case of sleep apnea, if sleep is constantly disturbed.
Let me ask you something, because there are lots of different kinds of treatment out there. There's medication, pharmaceutical interventions, and then there's something called sleep hygiene that doctors recommend. What is your top favorite medication choices for somebody who has insomnia?
Number one choices are that, that the cognitive, the treatment combined with the pharmacological treatment. So
Mm.
that is, is recommended because uh, we can start with different cognitive behavioral therapies, and that has to be supported by the pharmacological therapy. But pharmacological therapies should not extend very long. And
Mm.
in 6 weeks time period or maximum maybe 12 weeks time period, uh, a sleep specialist should try to take them off those medications and see that a regular sleep wake cycle has been established without the medications. But unfortunately, that doesn't happen. And also that sometimes the real life is different than
Yeah.
the uh, academic life and that what we learn in the books, uh, and so many other things. And as now as you have been mentioning that the hormone play a big role. So if let's say that the postmenopausal woman is having a problem and we are giving a cognitive behavioral therapy, we are giving a pharmacological treatment, but we are not looking at our hormones, because the imbalance between estrogen and progesterone can cause a big the difference, and that can provoke anxiety, that can provoke uh, uh, depression, and those are the two factors that can still will disturb the sleep. But if you look into those areas where you can get hormone replaced properly, or there's a nutritional deficiency that I have mentioned, that if they're suffering from anemia, so they will constantly have some problem with the restless legs, and that can translate into movement disorder of the sleep, and the sleep will be disturbed. So that's the. But again, coming back to your question, that thing, so should be started with both cognitive behavioral therapy and pharmacological treatment, and then depending upon your experience, you can taper them off the pharmacological treatment, and they can still follow the cognitive behavioral therapy, which is designed to make their sleep-wake cycle regular. So even over the weekends, they are not allowed to go on to, out of that agreed sleep-wake cycle and the time. So that helps.
Let me ask you a few questions. These are questions that our audience had for you, Dr. Khan. We call it the quick five. And here it goes. We'll try to get through them very quickly. Is there a test for insomnia?
There's no test as such for the insomnia, but to identify underlying sleep disorders, sometimes we have to send them for the sleep studies to identify, because when I was doing fellowship, we have, that was the launching the study for Sonata. We were looking for midnight insomnias, and a lot of the patients were disqualified because they have underlying sleep disorder, and the most common was periodic movement disorder of sleep.
Oh, interesting.
So yeah, but main thing is that a good history, and the sleep specialists need to take time to understand that the sequences from where it started.
Is melatonin a good treatment for insomnia?
Yes, but it has to be understood properly, because the melatonin affects the circadian rhythm. So depending upon the need of the patient, so where it should be used. So if somebody has to get up in the morning 5 a.m. for the job, and they are taking the melatonin late, so they will be groggy. They will not like melatonin, because melatonin will push the circadian rhythm into the daytime, and they have to sleep longer. So in that scenario, easier way for me to tell them that take melatonin in sunset.
That's a good idea. Is insomnia preventable?
Insomnia cannot be preventable sometimes,
Cannot be preventable.
because as we mentioned before, that any stressor in your life can set the insomnia in, and the insomnia persists even way after the stressor has been resolved.
Yeah, so that's kind of what I thought, but it's good to have a definitive answer about that. Do you ever recommend hormone replacement therapy for chronic insomnia?
Insomnias usually are chronic. So as I said, that there has been there for a while that are disturbing that we need thing. And I do, but it depends on that you are dealing with the patient. Sometimes they are so scared to go on hormone replacement therapy and everything. So, but I always recommend when I have an insomnia patient, I always look into the metabolic and endocrine causes, and that helps a lot. So I try to work with the primary care physicians, because in the insurance world, a sleep specialist is not allowed to work with the hormones. And so I try to work closely with either the gynecologist or the primary care physician, and that's how I can manage. Simple 25 milligrams of progesterone can do wonders.
And that can help even things out.
Yes, yeah,
That's
like
great.
that.
That's great. How do you know if you have gotten enough sleep?
That is that if you are waking up refreshed and you are
Yes.
not getting fatigue and thing during the daytime. So your body is very smart. The brain is very smart. It will always let you know that you are doing good or you're not doing good. Sometimes we are so busy that we don't listen to them.
I just have one final question because I was actually asked this on a national talk show, the Tamron Hall Show, and it was a topic that was getting a lot of play. It was if couples can't sleep together due to insomnia or snoring or something, whatever it is it okay for them to sleep in separate beds?
It's a tricky situation. Yeah, I think that till the situation is resolved, it's a difficult situation because
Right.
here involves your relationship and
Exactly. So, and so does your sleep,
but
right?
on the other hand, I have seen in the relationships getting sore because of
Yes.
the sleep problems
Yes.
as well. So it's there's no correct answer, but things need to be seen in the given scenario. So
Yeah.
if that's like for the time being, they can do that. I think that probably can help.
Thank you so much, Dr. Khan, for joining us. I mean, sleep and sleep questions and answers are so important right now, and people are so interested in this topic. Where can people find you if they have further questions?
You can find me through my website that has all the information. So it is neurologycasagrande.com. They can, just, call my office and set up an appointment.
And we will make sure to have a link up. So thank you so much. We will have a link so everyone can find you. And thank you to our Talking Live audience for joining us today about this very important and prevalent topic.